My name is Phoebe Layton, and I've been here at the Methodist Home since 2002. My husband and I both came from the state of Virginia, and we've been married 67 years. And I have 3 daughters who are grown, and then I have 4 grandchildren who are in their 30s and 40s, and 9 great-grandchildren.
Mrs. Phoebe Layton is just one of the more than 1.5 million residents our members care for each year, yet her story is unique. It is our commitment to excellence and high-quality care that ensures all of our senior and disabled residents, just like Mrs. Phoebe Layton, receive the quality care they deserve. In 2008, AHCA NCAL launched a new quality campaign to promote advances in long-term care and further our quality initiative.
AHCA and NCAL are totally behind quality improvement, quality activity, and building on the success we've had in the past.
I think the greatest thing that AHCA NCAL has done is established quality goals for all of us to abide by.
Our members recognize that quality and individualized care go hand in hand. Mrs. Phoebe Layton chose to enter assisted living and stood by her husband when he needed skilled care. But no 2 residents are exactly the same.
Quality long-term care has nothing to do with what I think it is. It's what the customer thinks it is. We have to be driven more by what our customers want and less by what other people think they should have.
The changing face of long-term care is that the residents we care for today are telling us where they would like that living situation to occur. And in addition, they're establishing the expectations that we not only need to meet, but we also need to exceed.
I think quality long-term care in any setting is care that's delivered that's compassionate. I think it's care that meets residents' needs and exceeds their expectations whenever we can.
Living in the healthcare center, I got to know very well a dedicated group that really do everything they can to keep you comfortable. They're just as friendly as they can be, and they just hug and make a big to-do over all of us older citizens.
Those that choose to work in the long-term care industry choose to work there because they care.
We organized a national coalition of frontline caregivers to reinforce the funding needed for high-quality care.
I want to commend the Coalition for Senior Care for bringing together healthcare professionals from around the country that share the common goal of making sure that our oldest and neediest citizens get the kind of skilled care that they need.
AHCA NCAL has taken bold steps toward developing a solution to the long-term care financing crisis.
Really, the idea is to put in place this federal benefit, which has very strong protection against catastrophic costs, but it does require individuals to do their part.
Our country really doesn't have a long-term care system. What we have is a patchwork of different programs that really don't work well together.
Our reform proposal is receiving positive feedback from policy leaders.
If you do not have some requirement for everyone to save for the future, you are not going to prepare the next generation for reality.
Any conversation about the fundamental health reform must include a discussion about long-term care.
AHCA and NCAL have a strong national voice. We are an effective organization with the power to make change. The AHCA PAC and increased grassroots outreach were vital to our success in 2008.
Our PAC is a vital component of our strategy to be successful here in Washington.
I believe that one of our strongest roles as operators of long-term care facilities is as advocates of the residents that we take care of.
By working closely with you, the 49 state affiliates, we effectively promoted our policy positions and quality agenda through significant media outreach. AHCA NCAL recognizes the power of the media to influence legislators on issues affecting long-term care. AHCA NCAL continues to have a strong presence and well-respected reputation on Capitol Hill. In 2008, we successfully preserved billions of federal dollars for long-term care.
This last year has been another home run year for Bruce Yarwood and the staff at AHCA.
The influence of this association is clear, and it generates great success.
AHCA represents me as a provider here in Washington. They're my voice in Washington.
Through testimony at key committee hearings, AHCA NCAL not only has the ability to take a stand on key legislative and regulatory issues, we've used these opportunities to restate our commitment to quality.
I am proud of the advances of our profession has made in delivering high-quality care, and we remain committed to sustaining these gains in the future when demand for care will dramatically increase.
I and others will continue to work to protect Medicare and make sure it pays appropriately for the care you provide.
This is a beginning. And I look across this room, I have confidence in the people of this room. People here can solve problems. And we can solve this problem. We've got to get started.
Nothing is better than being in your own home. But when you face reality and you have to leave, it's a comfort to be there, and we feel so safe and so secure and well taken care of. So it's been a very pleasant experience, and we've enjoyed it.
The pride we have for our profession reflects the level of care we provide. Today, let us renew our promise to quality for every resident like Mrs. Phoebe Layton, who deserves to receive the high-quality care AHCA NCAL strives to achieve.
I'm proud to work in long-term care because I believe I'm making a difference in the lives of the frail and elderly.
The people that I work with are wonderful.
It's an honorable profession.
Providing care to America's greatest generation is an honor and a privilege, and it's something we should all be proud of.